2, 3, go.
Hey gang, Dr. D basic health tip of the week. This is one of the most important things that I do in clinical practice is figuring out how people are not making energy. You need to make ATP, what the Chinese call Qi, or the Ayurvedics, traditional Indian medicine called prana, or what the Western biochemists called energy, to heal anything. If you're not making ATP, you're going to keep suffering and struggling in life. So, two main things we need to make ATP is we need to get the mitochondria of your cells fuel, and that can be in the popularized ketogenic diet, the version of ketones, where you're burning fat as your fuel, or glucose, which is the more traditional carbohydrates, feeding the mitochondria. Once you get fuel, you then need oxygen to make ATP. When in the presence of oxygen, you are in aerobic metabolism. That's burning the fuel in the presence of oxygen. Think of a log on the fire and you're using a bellow to really get that fire cooking. And that's called aerobic metabolism, or making energy in the presence of oxygen. And that's going to make you 38 ATP. And when you're making energy without oxygen, that's called aerobic metabolism, and you're only making 8 ATP. So clearly, it's important to have oxygen getting to your cells. And that's where we check for things like apnea, anemia, emphysema, chronic bronchitis, things like low blood pressure that can get in the way of getting oxygen to the cell. Today, I'm going to be talking about one of the biggest crimes to your physiology, which is glucose. Things like insulin insensitivity, the precursor to type 2 diabetes and metabolic syndrome, things like hypoglycemia, having low sugar, and things like type 1 diabetes, where you have an autoimmune attack on your pancreas islet cells and destroy your ability to make insulin, are all ways to corrupt getting steady, steadfast glucose to the cells. When I'm working with patients and teaching docs about blood sugar, I always use the word steadfast because it's fine to start getting glucose at lunch or dinner, but for certain body types, if you miss breakfast, it's a big deal. For other ones, intermittent fasting can be a great deal. So, glucose. When we wake up in the morning, we're going to pull a blood draw called your fasting glucose or your serum glucose, and we want that to be 80 to 100. Let's say you start your day with 8 ounces of fresh squeezed organic OJ. No different than a Coca-Cola. It's like having a Coca-Cola with an added vitamin C tablet. You're going to spike the living daylights out of your blood sugar. Your pancreas is going to over-secrete insulin. And the key word here is over-secrete. If you didn't secrete insulin, you'd be dead. That's the crisis a type 1 diabetic goes into. So you're going to over-secrete insulin. Insulin's going to open up that cell and suck that glucose out of your bloodstream, and you're going to result in a hypoglycemic attack. Hypoglycemia is very uncomfortable. The brain doesn't like it. It feels like primal anxiety. More than we need a hug from mom and dad, we need steady fuel to the cells. So things like depression, things like anxiety, things like fatigue, things like attention deficit disorder, all of these brain spectrum issues are fully dependent on, is the brain getting fuel in ketones or glucose. So the first thing we have on our list here is carbs. And this can be pastas, pastries. I always joke that the middle aisles of Whole Foods and natural grocers are organic gluten-free diabetes. So if you're hitting the rice crackers and the quinoa pastas and so on and so forth, you are doing this. If you're hitting the organic juices, you put an orange in a juicer, out one side comes the fiber, out the other side comes the sugar water. So there is a therapeutic point for juice fasting and things like that, but you have to realize it's not much different than a Coca-Cola if you're hitting those on a regular basis. The second one is alcohol. Remember, we are just fermenting high carbohydrate substances to make alcohol. We don't make kale vodka. We don't make beef beer, right? We find grapes from Champagne, France. We put them in a vat with brewer's yeast, and out the other side comes wine, or what I like to call sugarol. So alcohol in moderation with a balanced meal, not the end of the world. Hitting a 4 p.m. glass of wine on an empty stomach, is going to get you over here. The therapy for that, of course, is another glass of wine. And you're just going to spike your blood sugar all over again. And you're going to keep doing this until your pancreas says, I quit. And that's where you start going insulin insensitive and eventually type 2 diabetes, where the insulin key no longer works to unlock the cell and allow glucose to enter, and you get glucose accumulating in your vessels, and you start sugarifying everything. That's measured with a hemoglobin A1C or glycosylated hemoglobin. How sugary are your red blood cells? Do they look like a Homer Simpson Krispy Kreme donut loaded with sprinkles, or do they look clean? So the third one here is THC and THCV. These are the two portions of cannabis or marijuana that actually trigger hypoglycemic response. And this is why THCV can actually be used in diabetics, people who have high blood sugar, to normalize their blood sugar. But if you have normal glucose, you can trigger a hypoglycemic event off THC as well. CBD, just non-psychoactive CBD, does not do this. CBD is a lot like fish oil. It follows the basic anti-inflammatory effects. So we want to make sure that you don't go through peaks and valleys in life, and that you get that blood sugar steady. So really watch it on the carbs. When you're doing carbs, do vegetable fiber, carbohydrates, low glycemic fruits, things like berries, cherries, raspberries, blueberries, apples, pears are on the lower side. Your tropical fruits tend to be more spiking. Eat them in concert with the fiber. Once you throw it into a juicer, out one side comes the fiber, out the other side comes the sugar. Alcohol in moderation is okay. Check yourself before you wreck yourself. If your booze intake is crazy, you need to seek help or put yourself on a 6-week to 6-month booze fast and see if you can hang. If you can't hang, you got a problem. And the problem, if nothing else, is type 2 diabetes is coming for those. And then be careful and mindful if you're someone who's using recreational or medicinal THCV in whole cannabis, whether it's smoking or edibles, because that too can give you a hypoglycemic attack. Keep the fuel steady and the energy keeps pumping out, and you'll be a happy camper. We'll see you next week to learn more about body typing and the difference between the thin, lanky, deficient body type and the more substantial excess body type. See you soon.